Welcome, everyone. I am so excited to welcome you to this launch of the 2021 Washington Global Health Landscape Study. I am KR Prabha. Prabha is my first name, and those of you who've known me for a while know that there's a history around how we have names in southern India. But I am the board chair with Washington Global Health Alliance, and in my day job, I'm also the vice president of strategy, growth, and innovation at Optum, which is a health services innovation company. So I work in U.S. healthcare through the day, and then also my interest in global health is fulfilled through my involvement with WGHA. I want to thank each and every one of you, and I know we have a diversity in our attendees today for joining us today, this Thursday. And for those of you who are not familiar with our organization, the Washington Global Health Alliance, we are a connect and inform organization within the global health community here in the state of Washington, and obviously support the global health agenda, both here in the state, across the country, in the other Washington, and also across the world in many different forms as we support our members who come together and have a collective impact across the globe. So, and you will, if you go to our website, you will see that our mission is about connect and inform the global health community. And so that positions us extremely well to, stand back, see the big picture, bring together the right partners, and look at the collective impact that we have as a community of organizations working in global health across the world. This is our fifth global health landscape study. Our organization had been formed about 15 years ago. And so in the last 15 years, we've seen a lot of change happening. The prior study so the very first study that was commissioned identified global health as a sector. And by now, obviously, with the onset of the pandemic, it's become very clear that global health and health itself, the lines are very blurred. So it's not about health here and global health there, but global health issues, global health solutions are applicable in daily life in our regular US healthcare as well. The study that was done just before the pandemic was released in 2018. And since then, you will hear more details, but what you will hear is that the sector is growing. That means there are more jobs in global health. We have a lot more impact in terms of dollars, whether it is through supporting the various initiatives, the impact that we do on the community, or just plain taxes because of the organizations who work here in the global health sector. And finally, talent. We attract a lot of superior talent here within Seattle, which is an international hub for global health. And I believe we're privileged to not only work in global health, but to be working here in Seattle, where we have so many organizations, both from a care delivery standpoint, research standpoint, innovation, and just policy and advocacy standpoint, who focus on this sector. So I'm not going to spend a lot of time around going over the highlights of the study, but when I read through it, I will tell you it really brought home to me of how big this is. Our impact, while we are a small organization in Washington Global Health Alliance, but with partners like you and our members, really the outreach is to over 162 countries, and that's big. And our impact is in big dollars, which is like billions of dollars, double-digit billions of dollars. And so what we do here, what our team here with Maurizio, Megan, Kayla, and a few others on our small and mighty team, what they do on a daily basis has a far-reaching impact across the world. So with that, I hope that our representatives, I see quite a few of you from the government, from our civic and corporate communities who've joined us today. I hope you feel new appreciation, not only for the value that our sector brings to this region, but also pride in the fact that we, as a Seattle-based organization, can actually have that much of an impact across the globe as well. And we are in a unique position to take that message forward for global health and identify various innovations to bring to this area. So I would now like to hand over the next part of this presentation to Sarah Nino from our RTI International members, who led the research and the methodology and developed this study for us, and have all interesting things and facts, figures, but also just what they find as they went through this study and compared it to the last one to share. So with that, Sarah, welcome and thank you for sharing with us your work, your team's work, and what we should be excited about in global health.
Thank you, Praha. I really appreciate the opportunity to be here and speaking with you today. So my name is Sarah Nino, and I'm coming to you from North Carolina. We've had a beautiful day here today, and I hope you're having a wonderful afternoon in Washington State. I'm a research economist with RTI International, and RTI International is an independent nonprofit institute that provides research, development, and technical services to government and commercial clients worldwide. RTI is also a member of the Washington Global Health Alliance. Before Maurizio gives you the report highlights, I wanted to provide a bit of background about the project and discuss the report's methodology. The Washington Global Health Alliance has been measuring the contributions of global health organizations on Washington State's economy since at least 2015. And this report is an update of the one that RTI produced in 2018. And this year we've made several important revisions to our definition of global health, the report methodology, and the content of the report itself. So for this study, RTI defined global health as working to improve the health of the world's most vulnerable populations, both domestically and internationally. The last part of the sentence, both domestically and internationally, was added this year to acknowledge groups that are working to eliminate health disparities within the United States, as well as those groups that are doing work internationally. Organizations that comprise Washington's global health sector include nonprofits, academic programs, corporations, research institutes, and faith-based organizations, among others. The common theme among these groups is that their work contributes to solving global health challenges, such as infectious and non-communicable disease, food security, new advances in medical treatment, and planetary health. Some of these organizations provide direct medical care, raise awareness of health disparities, or advocate for social change. Others research specific health conditions and train the next generation of global health workers. The jobs and income created by these organizations ripple through the economy, supporting additional economic vitality across Washington State. Next slide, please. So I just want to give you a little overview about the process that we went through, and maybe just kind of let you know a little bit about our methodology. So we went through a really extensive volley of research to determine and characterize the actors in the global health field in Washington. So first staff, we went back to the last effort and we went through the process of determining if the groups were still active in Washington State and if they were still engaged in global health work. And that eliminated about 125 organizations. And we also looked for groups that were not directly supporting global health, but they might be, indirectly supporting the sector somehow. Then we went and we searched for new companies and new nonprofits in the global health space. And many of these new organizations are small companies that were identified when we searched for groups that had received federal grants for global health related research. And since there isn't a universal definition for global health and what constitutes a global health organization, this process is inherently a little bit subjective. And so the Washington Global Health Alliance really helped us by providing final decisions on which groups should be included in the study. Then we went out and we did a survey of the membership of the Washington Global Health Alliance to learn more about specifically what types of global health activities they were engaged in, where they were active, and how the COVID-19 pandemic had affected their organization's operations. And if you may have been one of the people that received our survey back in the fall, through your email account and wondered what we were going to do with this information. So this is the result of that process. And thank you if you filled this out. It provided us with a lot of really good information. Next slide, please. There were three major changes in the study this year as opposed to the one that we did in 2018. So first, the study switched from using the Washington input-output model to using IMPLAN. And so IMPLAN, was used to really render the state economy, and it captures the transactions and spending flows across industries and through, for instance, employee spending. And the use of IMPLAN is going to allow for better comparability with other economic impact studies conducted in other regions. And in addition, if the Washington Global Health Alliance were to expand to another state, such as Oregon, and become the Pacific Northwest Health Alliance, then we would just be able to add that state into a region in IMPLAN and be able to measure those impacts. Or we could also measure the impacts of Washington Global Health Alliance on the entire United States economy. So we believe it'll be easier to replicate the study in the future by making this change. Second, this year, RTI relied on employment data from the survey, from organizational websites, commercial business directories such as Dun & Bradstreet, and from nonprofit tax forms. Previously, our employment figures were estimated based on data from the Washington State Employment Security Department. And in some instances, we had to make estimates based on the size of an organization. We believe this change has improved the employment estimates. Finally, the state leveraged the partners of the Washington Global Health Alliance to tell the story of Washington's global health network impact across the globe and at home, as well as how the coronavirus pandemic has affected organizations. So there are three different stories that we have included in the report that highlight the amazing work that organizations are doing to improve the human condition around the world. Next slide, please. So again, I want to thank you for being here with you this afternoon. RTI International is pleased to be a member of the Washington Global Health Alliance, and we're honored to be selected to complete this study for you. The research team has really enjoyed learning about the unique global health ecosystem in Washington, and we hope that you find this report useful and enlightening. Thank you.
Terrific, Sarah. Thank you very much. And I do want to point out what I think your organization represents in our membership. Even though the study that we're going to unveil for you today is focused on the state of Washington, you can kind of see from, for example, RTI being a member in from North Carolina, that really the state boundary are blurring. And that the ecosystem that is being created in studying in Seattle, expanding to the state of Washington in general, is now becoming very much a national and an international ecosystem. And our membership is going well beyond the borders of the state of Washington. in ways that are going to benefit both our local and our global impacts. So I am going to walk you through the highlights of the study. The study will be and is freely available, and anybody who wishes to receive a copy can either email us or go to the website of the Global Health Alliance and download a copy. The data that we're going to be presenting to you is very broad. It covers employment, it covers geographical positioning for a lot of our organizations that are part of these ecosystems. It covers wage data and economic impact data. It covers this notion that rapidly this ecosystem is not just an ecosystem that generates good economic activity, but it's an ecosystem that is starting to generate cutting edge innovation that is likely to become transformative in healthcare, healthcare delivery, healthcare impacts. So going to some specifics, if we can go to the next slide. Let's start looking at the impact of this ecosystem based on the job figures. The survey is based on feedback from 196 Washington-based organizations working in global health. And I know Prabha mentioned Seattle as the starting point. One of the key trends here is that we are seeing the activity and the impacts and the ecosystem expanding well beyond the boundaries of the city of Seattle, and certainly to the Puget Sound region, but also to Eastern Washington and really the state in general. And as Sarah mentioned at RTI, we're also starting to see incredible collaboration and synergy, including the expansion of these organizations well outside of the state of Washington. I am actually today talking to you from California, and it's just amazing how many California-based companies and organizations, how many Silicon Valley-based innovators, as well as moving well beyond the rest of the country and overseas, are all starting to collaborate in this very vibrant economic picture. Prabha already mentioned that our organizations in the survey are operating in 162 countries. This is a pretty global picture, and that means they are also responsible for employment and economic activity in those countries. So this sort of induction that is showing positive numbers for the state of Washington is really also showing very solid numbers for the rest of the world. It has been estimated in the study that roughly 16,000, almost 17,000 employees are directly employed by the 196 organizations in the state of Washington. When you compute the indirect and induced jobs, meaning the rest of the ecosystem that essentially is created around the core organizations, the total number of jobs rises to about 41,000 positions. And the other interesting statistics that we were able to see is what these organizations are focusing on. The vast majority, 62%, are involved in what we would call health system strengthening. That means that they are involved in the innovation and the improvement of how healthcare is delivered, both from an equity of access to healthcare, as well as from a health system component. And this is key to understand, because it's key to understand that global health is really no longer something different than regular health. We have many very important healthcare providers that are primarily focused on the domestic healthcare delivery, that are also helping us incorporate what I would consider best practices that are being learned overseas and in many of the settings that global health is operating, and they're literally bringing those ideas back home to improve health equity, health access, and effectiveness of the healthcare system. And that, by the way, transcends whether we're talking about private healthcare systems, whether we're talking about public healthcare systems, whether we're talking about healthcare systems versus public health. All of those factors end up being touched by the work that the global health organizations are doing. And we're seeing that trend accelerating. That same employee basis has a very direct wage, salary, and benefit contribution to the resident of the state of Washington. And if you look at the wages, salaries, and benefits of that are directly involved in global health, that has been calculated to be about 1.3, just shy of $1.3 billion in the state. And when you add the indirect effect, that comes up to almost $4 billion. So it's a very important sector of our employment. And it's also important because these are not low-paying jobs. These are high-paying jobs with, the average direct per job wages, salary, and benefit of about $129,000. This is a long-winded way of saying that this machine, this ecosystem that is surrounding global health, is an attractant of the kind of talent that that Prabha and Sarah mentioned earlier, and it is dramatically contributing to ultimately the welfare of the state. In terms of direct translation of this economic activity, the study has calculated the contribution or the additions to, for example, state and local tax revenue. And that estimate, again, for the surveyed organization ends up being at about $361 million annually. And a contribution to the overall size of the economy in the state of almost $11.2 billion. That, when you start translating against the total population of the state, about 7.7, 7.8 million people, ends up being over $1,400 per person in terms of the contribution of the global health community. So these are pretty impressive stats. The fact that global health is really focused on improving the health of the most vulnerable population qualifies the work of a lot of global health practitioners to be very specific around the question of health disparities and health outcomes. And if the COVID pandemic has taught us anything, is that unfortunately, even in an advanced healthcare system like the US, the health disparities are still tremendous, and ultimately clinical and other outcomes are affected by those health disparities. It is in that equation that we're seeing a lot of learned lessons start to migrate the other way, almost in a reverse innovation mechanism, where things that are learned in poor parts of the world or developing countries all of a sudden become very relevant here at home. And this sort of global to local is a big component of the work that the Global Health Alliance is doing, but also that we're doing with that many of our organizations and membership are doing. Finally, I wanted you to get a sense of the demographic of our organizations. Historically, global health has been thought of as being primarily a nonprofit and an academic and a research type of community. But I want you to see that almost 50% of the organizations are actually for-profit organizations. So companies doing the right thing, focusing on impact, but managing to leverage innovation in the sector to ultimately also make money. And that is a big trend and a change that we're seeing since our 2018, where these public health and global health topics are no longer the purvey purely of the nonprofit sector, but there's actually businesses that are getting built to ultimately commercialize the innovation and drive this economic activity. Next slide. One of the reasons why innovation is starting to become a very significant component of the work that our organizations are doing is because the subject matter surrounding global health are starting to attract very significant research funding. Now, research funding was always very healthy for the global health sector, but we wanted to try to quantify the research funding that was coming into the state of Washington specifically. And I think using the NIH, the National Institute of Health, as a metric, approximately $4.5 billion in annual grant funding came in between the 2018 and 2020. Sorry, I correct myself. It's not annual funding, it's a 3-year funding. So that's a huge amount of federal research money that is benefiting our institutions and that ultimately are driving this ecosystem of activities. Next slide. The other thing that we noticed in the report is that the growth of employment in the sector is outpacing the growth of employment in other sectors. So not only is this a fairly large contributor to the economy, not only is the sector relatively large within the state economy, but it's also in higher growth than other sectors. And you know, to give you a sense of again, this sort of the impact of that research funding into our community, about 70% of the Washington global health employment is clustered in the research and development and services sector. And of course, that also becomes an engine for these sort of innovation-driven activities that stand for the sector. We mentioned this already, that there is a very significant indirect component to both the employment and the academic community. For sake of time, I won't take you through the details of that indirect, but it is well qualified and quantified in the study itself. And next slide. And I want to end with a comment on the human impact. COVID has catapulted the state of Washington into the global sort of front line. Many of the key technologies that have brought us vaccines, many of the key validations to those technologies, many of the responses, many of the data and data tracking methodologies, all have their origins in the state of Washington within this ecosystem. Our good folks at IHME, the Institute of Health Metrics and Evaluation at the University of Washington, produce many studies that relate to the global burden of disease. And we thought it would be useful for you to see the context of what's essentially the global burden of disease worldwide. And these boxes, the size of the boxes, represent the mortality, the sort of death of the different key disease buckets, the blue boxes being non-communicable diseases, the red boxes being communicable diseases, and the green boxes being other things. And, you know, in part because of the effort of the organizations in this state, you know, since 1990, we have reduced preventable deaths worldwide by a staggering 16.6%. Now, of course, the state of Washington and our organization can't take sole credit for that, but we are obviously a key contributor. And if you look at the areas that the our organizations are working in, such as healthcare system strengthening, maternal and child malnutrition. These are all key front and center activities of the organizations in the state of Washington. So, we continue to be very encouraged by the fact that it's not only a growing sector and big business, but it's a sector that matters. It's a sector that is impacting people for the better, and is doing so on a global scale. With that, I want to thank you for listening to my remarks, and I am going to turn the conversation over to Megan.
Thank you very much, Maurizio, for helping us to understand what that study has looked like and what it's brought to us. There are a lot of key findings that some of which were surprising and some of which we sort of already knew, but we're really glad to have a better understanding of what that looks like, not only from an economic standpoint, but from an impact standpoint as well. So I'd like to take a moment to introduce our first speakers. We first have Nikolai Gilbert. He's the president and CEO of PATH and brings to his role more than 20 years of international experience as a leader, strategist, and director of complex partnerships. Nikolai, we do recognize your timing is tight today, and we're grateful for you making time for us. And you may need to sign off a little slightly before the rest of our panelists in today's discussion. We also have Hilary Godwin. She's the Dean of the University of the Washington School of Public Health and professor in the Department of Environmental and Occupational Health Sciences. She has considerable experience as an academic leader with expertise in interdisciplinary collaborative research on nanotoxicology, and the chemistry of lead poisoning and its impact on public health. We also today have Britton Gray. She's the Executive Director of Global and Domestic Immersion Programs at Providence, where she establishes external partnerships to empower Providence to engage with local and international humanitarian organizations. And Jim Kublin is the Executive Director of the HIV Vaccine Trials Network, HVTN, and COVID-19 Prevention Network at Fred Hutch, as well as a board member of WGHA. So let's go ahead and start the discussion with you, Nikolai. We learned in the landscape study that Washington-based organizations are working all around the world. Clearly, the bulk of the work that we do is focused on improving health in other countries. Increasingly, we understand that the work and the people engaged in global health work have value here too. How would you describe the value to the communities here in Washington?
Well, thanks, Megan. It's great to be here with you all, and I hope to get some new friends doing this call, because we are one family, one ecosystem, as Maurizio also mentioned. I'm a newcomer to the state, so maybe I'm not the perfect one to respond, but I will give it a go. I came to Washington State 18 months ago, and it's been remarkable to actually experience this ecosystem and this knowledge sharing and the impact that this state has all around the world. So I've been surprised of that coming to the state from Denmark, my home country. I would say that the job creation that Maurizio is mentioned, the ecosystem was mentioned, but also beyond that, the knowledge sharing at an academic, institutional level that Hilary maybe is going to speak more about. I mean, how does that help on pandemic preparedness, this scientific collaboration when you track variants through laboratories around the world, the clinical trials that are executed? All of that knowledge comes back and makes our information more rich in terms of what can we do to actually keep also the state safe and the people safe in this state. So there's a lot going on beyond the economics, I think, of the value add of all these actors. I think was also mentioned the fact that not all great ideas are coming from Washington State. There is a lot of sourcing of ideas that comes from all around the world. And these networks that all these organizations has incredible value. Also addressing the diversity in the Washington State populations, because many of those countries that are worked in also has populations here in the Washington State. and with significant health challenges as well. So that also brings in important knowledge to the state and help inform our decisions here in the state. And maybe the last thing, which was not talked upon before, is that, I mean, we have 400 people here in Seattle working for PATH. We have 600 in the US overall and 1,000 around the world. Some of the things that we do on the innovation and R&D space is actually helping to pilot solutions for companies that has seen an unmet need in a given disease area. So it could be a new diagnostic solution, it can be a new device, and what we do is actually help, pilot some of these innovations, and some of those companies are coming from here. So how do you help them test this out in communities? How do you do human-centered design, and how can that help them, develop their innovation further and make it applicable for maybe a larger audience or other countries or geographies around the world? That has a lot of value. And one example is the way we are tracking malaria in communities around the world is actually developed by using an IT company here in Washington State, IT solutions and dashboards that we can apply there, and has been very successful in also keeping that country on track on elimination of malaria. So that's just a few examples. I know we don't have much time, but back to you.
Fabulous, Nikolai. Thank you so much. I know that personally in my career, I've utilized PATH and leaned on you heavily for much of the work that we do in global health. And so I appreciate your thoughts on this and your partnership. I'm going to move to Jim. Jim, the pandemic has put global health really into the spotlight, something I know that you all are well aware through your leadership of the COVID-19 Prevention Trials Network at Fred Hutch. I'm wondering if you could share your thoughts on what seems to be blurring of the lines between global health and regular health, and what impact you see this having on communities in the years to come.
Oh, thanks, Megan. It's a great question, and really one that I've been thinking about most of my career, because I've been focused on international health, and of course that has evolved to be more attuned to global health, and both of these terms really I think have been made more aware to us in the Northwest, people across the US and around the world, because we've seen how a virus that starts in a small localized geography becomes a global pandemic. And of course, we've known that this can happen for hundreds of years. And over the past 100 years, these two major pandemics of flu in 1918 and HIV over now almost 40 years ago bring to light that this phenomenon is both a historical reality and one that we're going to face again, unfortunately, in the future. And so how we think about global health vis-a-vis regular health or personal health is something that I think we are all thinking about more often now. And I think that's a fantastic thing. My work here at Fred Hutch is in no way limited to just the work in Fred Hutch. We've been collaborating with PATH on one of the diagnostics that was just mentioned, and we've collaborated with Seattle Children's, and I'm of course on faculty at the University of Washington as well. And part of my work is, of course, been immersed in SARS-CoV-2 and COVID vaccine development over the past 2 years. But HIV, TB, and malaria have really been, my primary focus throughout my career. And more recently, looking at the microbiome and how this microbial population changes across human populations and how it can impact vaccine responses. And this highlights also the very local gut ecology, but also this global ecology that really does inform who we are and how we respond to things like vaccines. So I find this all to be a fascinating evaluation of what is regular or personal health and what is global health or one world health, and what we think about this in the context of personal and public health. And I think, it all leads to a better understanding of how we are striving in general for the same thing, which is the health of individuals, communities, populations, and ultimately a healthy planet, of course, without which we're not going to be breathing good air or feeling, perhaps particularly in the Northwest, the healthy, clean water as it rains upon us. So in the U.S., we've been focused so much on, prior to this pandemic, I think, so much on what are the major health issues in the U.S. with regard to those major health issues such as obesity, tobacco, substance use, and the resulting mental health and injury and violence that results from these issues. And I think, for now an appreciation of global health and certainly the burden of infectious diseases, but as Maurizio was highlighting, non-communicable diseases are really a global challenge for us all. Just this week, we had World Malaria Day on Monday. And one of the fantastic consequences of this terrible pandemic has been a tremendous appreciation for the importance of clinical trials, of participating in clinical research, however one may be able to do that. And on Monday, on World Malaria Day, we infected 21 altruistic Seattleites with malaria to test the malaria vaccine, which is showing much promise. And we have upcoming TB studies that we're doing here in Seattle, focused on novel TB vaccines, as well as the historic TB vaccine BCG, which has been in existence for over 100 years and been given to billions of people throughout the course of these decades. And so I think it's a tremendously, really exciting time to be hopefully moving beyond this current SARS pandemic and reassessing how best we can really contribute to global health. And by that, I mean all health, individual health. And that means that even the smallest health departments that may be located in rural areas, in small towns, and even in the big cities need to understand these global health issues. And that's also been made very obvious by the current pandemic. And also reflecting on this, we've seen politics and the vicissitudes of that, and sometimes a tendency, although not always, to focus on tribal and national issues, whereas health really is a universal global issue that must be addressed and challenged with the kind of transnational global outreach that I think all of us in the Northwest and all of us who as members of WHA exemplify and continue to prioritize in all of our work. So I'm very excited by the future and the opportunities we'll have to direct our technologies here in the Northwest to solving some of these global challenges.
Thank you, Jim. I truly appreciate that. In fact, I know that all of us owe you, your colleagues, and your team a debt of gratitude for helping us move through this pandemic. Moreover, if you ever need a malaria clinical trials volunteer, please let me know. I'm not a huge fan of getting stabbed, but I happily do so if it means that I can avoid taking Malarone. So I'm going to go ahead and move forward to Britton. Britton, there are those who think of Providence mainly as a local healthcare provider, not realizing the global reach Providence has, specifically through its partnership with other organizations. Can you share your insights into the importance of partnerships in making positive social impact, and any advice that you have for organizations thinking about how to build effective and strategic partnerships to further their respective missions?
Thank you so much for the question, Megan. While Providence is best known for our Western US presence, our vision of health for a better world and our strong belief that health is a human right motivates us to partner with global health organizations in Latin America and in Africa. And partnerships are vital for fostering global health interconnection and relationship. Our own approach within Providence has really been to build global partnerships with a positive social impact by focusing together on capacity sharing. We found that it is through partnership that we've been able to foster and support community health initiatives to ensure that families have access to the health information they need on the most urgent issues they face, and ensure they have the tools and resources to inform social and behavioral change to reduce the burden of disease. Often the best health interventions happen neighbor to neighbor. And so this element of our work is so important to us. It's also through partnership that I think we can walk in lockstep with and honor the leadership, expertise, and goals of local health leaders in other parts of the world. Partnership allows us to move in solidarity, to aid in capacity sharing at the health system level, to advance this generation and the next of providers, and strengthen care delivery in response to needs identified by locally governed assessments. These positive social outcomes are driven by collaboration and relationship. And with regard to the second half of your question, thinking about organizations who are looking to build effective and strategic partnerships, I would encourage considering the role of three things: subsidiarity, sustainability, and solidarity. The social justice principle of subsidiarity calls us, whenever possible, to defer decision-making to those at the level most directly impacted. Local health and community leaders know the grounded reality and difficult nuances of the challenges they face, and they also know the population's strengths that will enhance health outcomes. Sustainability, of course, is also vital. By localizing project ownership, partnerships undergird a sustainable frame that empowers a long-term change and can also redress the systemic health inequities that are the legacy of colonialism. When global health projects are considered evergreen, setting up alternate siloed systems of support that can't be locally integrated or locally led, when there's really no intention of ever transitioning or localizing power, sustainability can never be achieved. And so by working with partners, engaged with leaders at the community, health system, and policy levels, and by orienting partnership priorities to the goals of those leaders, I think we can contribute towards sustainable health advancements. And thirdly, thinking about solidarity, by opening to solidarity as a global call and seeing ourselves in relationship to, rather than separate from, the global healthcare delivery system, we affirm human dignity and that the life of a patient in another part of the world matters just as much as a patient in the US. Solidarity empowers relationships, it motivates accompaniment, and it catalyzes a sense of kinship that fortifies commitment. As we deepen in solidarity, we also accelerate in action. And I think solidarity calls us to learn with humility and act with urgency. So to close my comments, in thinking about how we engage our medical community within Providence, within partnership work, something that others within global volunteer efforts may be interested in is the Broche Declaration on Ethical Global Volunteerism. Providence joined other global organizations in signing this in 2021, and it has served as a beautiful point of reflection. I've used it when connecting with internal stakeholders about the balance of power within our work, about our ongoing call to build partnerships that will make our support irrelevant in the future, and which advance the decolonization of global health. As global citizens, I think we all play a part in health for a better world. Dr. Martin Luther King said that the moral arc of the universe bends towards justice. And personally, I believe that we need to give our full weight to bending that arc together in partnership. Back to you, Megan.
Britton, incredibly well said. There's no question that the partnership that we've had with Providence is so incredibly meaningful, especially in terms of the health system strengthening. So we greatly appreciate your thoughts, and I could not have possibly said it better myself. So thank you so much for that. I'm going to move forward to Hillary, and I apologize. I know we're a little bit short on time. Hillary, partnerships are one way to maximize impact, and education is another equally important part of this conversation. Inspiring the next generation of public health workers is important to ensure the positive social impact of global health organizations continues. You play an integral role in that as the Dean of the University of Washington School of Public Health. I'm wondering if you can share your thoughts on the positive social impact that you see future public health workers having here in Washington, as well as what changes, if any, have you observed in the field of public health education over the years? And do you think there will be noticeable changes to the kind of impact that we can expect to see in the field of global health? And I realize that's a very loaded question. So.
Yeah, thanks a lot for the invitation to speak to everyone and to join this great group of people. As you can tell from the other folks that you've heard from, public health people are great people. So I would just posit that, like, one of the great contributions of having a big public health workforce here is that you have built in this group of professionals who have a strong commitment to public service and the common good, regardless of whether they go into public sector jobs, nonprofits, or for-profits. So that's a big win for the state of Washington. And totally, I can see that in the ethos of Seattle. It's really a lovely extended community. In terms of trends in public health education, I'd say over the last decade and a half, there's been a very explicit shift towards training public health professionals to be what we call chief health strategists, which means explicitly calling out that public health professionals should be engaging multiple sectors and community partners to generate collective impact. And so it's a great transition into sort of our next group, which is the government panel. We are training folks that hopefully are going to be reaching out to you and trying to work collaboratively for the greater good. And the other part of that shift has also been a greater focus on societal systems and structural factors that impact the health of populations and communities. Over the last 5 years or so, that's specifically been manifested in a growth and attention to within both the local public health and global health communities on the impact of racism as one of the most important upstream determinants of health. So you've probably seen that in King County. We've had a declaration of racism as a public health crisis. Same thing for the Washington State Public Health Association. One of the few silver linings to the COVID crisis, from my perspective, is how visibly it has communicated to the general populace that racism is an incredible factor in determining ill health among different populations, and is a major factor in those differentials that we see in terms of communities who are impacted by this pandemic, but their health overall. Within the field of global health, the sort of mirror of that has been efforts to recognize the impacts of colonization on the health of populations worldwide, and being very explicit about working to dismantle lingering manifestations of colonization, whether it's at a societal level or in the work that we're doing within our own field. And I just say one clear example of that, which I know the WGHA folks know very well, is a clear call to shift funding within global health research and implementation projects that are occurring in the global South, to have that funding going to researchers and global health, public health professionals in their own countries, as opposed to feeding through Western and US organizations and researchers. So that's a huge underlying shift that is impacting our entire ecosystem, but also really important in terms of, I think, how we as a community think about the kind of work that we do, and coming back to what Britton was saying, really thinking about how we are good, really quality partners for the people that we work with in country. Absolutely. Finally, I'm going to give you one last one. I know we're running late, but I just want a great example of a cool, new, innovative educational program in global health. We just launched at UW in the Department of Global Health, the first ever Doctorate in Global Health Leadership and Practice, which we call a DRGH, which focuses on generating practice-based leadership skills for experienced public health professionals from countries across the world and developing those skills in global health settings. So I'll put a little thing in the chat about with the link to that, but thanks very much. Really appreciate being here and hearing from everyone today.
Oh, Hillary, that's wonderful to hear. And thank you so much. We absolutely do share your views of needing to have those funds go directly into the country where they need to be deployed. We want to give a big thank you to all of our academic and NGO panelists today. Thank you so much for joining us. I'm going to go ahead and now hand this over to Maurizio, who will be moderating our government panel decision. And Maurizio, I apologize. I know I ate into a little bit of your time there, but it was compelling stuff. So,
well, it is a fascinating discussion, and thank you, Megan, and thank you to the panelists. I am very honored now to introduce you to our distinguished government panel. And before I introduce our individual panelists, I wanted to tell you philosophically how and why we structured the panel the way we have. I think you already heard from Dr. Godwin and some of the others that one of the key mega trends that are going on in global health is the sort of decentralization and decolonization that really in part is highlighting the role of the local community as opposed to the central planning or the international community. And when we start thinking about our ecosystem, you know, we already mentioned that it's a lot more than companies and organizations in Seattle. And even if you look at the sort of shift of where people and organizations are, we're seeing this sort of shift to local and to think local and act globally, so to speak, throughout our community. So for our government panel, we really wanted to hear from the leadership of local communities and specifically our wonderful mayors across a representative samples of Puget Sound cities. And so I'm very pleased to introduce you to Mayor Angela Burney, of the mayor of the city of Redmond. Mayor Burney was elected in 2019. She served on the city council from 2015 to 2018 and was the council president from 2018 to 2019. Mayor Burney currently serves as the Sound Cities Advisory Board president. Thank you very much for joining us, Mayor Burney. I also would like to introduce Mayor Lynn Robinson from the city of Bellevue. Mayor Robinson has been mayor of Bellevue since January 6, 2020, and joined the Bellevue City Council in 2014 and has a long history of civic involvement. She's a champion for startups and innovation, small businesses, human services, and affordable housing. Mayor Robinson also represents the Council on the King County Mental Illness and Drug Disability Advisory Committees, the King County Affordable Housing Committee, and the Puget Sound Regional Council Executive Board. I'm also pleased to introduce you to Rachel Smith, the only non-mayor panelist. Maybe that's a suggestion, Rachel, for your future career. And Rachel is president and CEO of the Seattle Chamber of Commerce. Rachel brings nearly 20 years of government affairs, policy operations, and advocacy experience, including 13 years serving in local and regional government. And finally, Mayor Penny Sweet, representing the city of Kirkland, is also with us here today. She began her first term on the Kirkland City Council in January of 2010, and we're really very honored to have her join us today. So I would like to start maybe with you, Rachel, given your role in the Chamber of Commerce. One of your areas of focus at the Chamber of Commerce is ensuring that our region has and can attract the skilled workers we need to sustain our industries. Do you see Washington's global health sector as helping you sustain and attract skilled workers? And if so, how?
Absolutely. And thank you so much for having me. I like to say that I'm recovering from government, but I am here on a panel with 3 of my absolute favorite regional mayors. And so it's an absolute honor to be here. And thank you so much. And I would say, you know, for all sectors, quality of life has become a critical measurement for our business community. As our members across the region, including global health members, work to attract and retain employees to move here or to stay here, quality of life has a really significant impact on our ability to compete globally for our local workforce. Just a couple of weeks ago, the Chamber released the second installment of our new public opinion research project, The Index, and it measures quality of life over time by asking Seattle voters about the region's most pressing issues, including homelessness, public safety, affordability, downtown Seattle recovery. And as a business person, you might be asking, why are you asking the voters this? And they are our employees, the employees that live and work and play and vote here. And through this research work, you know, we're able to surface the voter opinions to inform the conversation around really complex issues. And it demonstrates where there's broad agreement from the public. Voters in this survey pointed to really real issues. Public safety concerns rose starkly. Homelessness crisis remains a top concern, and affordability and cost of living issues are really gaining steam. And actually here at the Chamber, we've made the case that addressing affordability has to start being a priority for all of our leadership in every city in the region. And we hope that elected officials will get on board with us and help lead the charge in addressing the regulatory and zoning and barriers to building more housing, leasing places to start a business, or opening a childcare facility. And we have great leadership examples right here on this panel of mayors and leaders that are doing that. So that's kind of, I think, a general picture that I wanted to paint of the importance of quality of life to workforce generally. But how do I see Washington's global health sector helping the region sustain and attract skilled workers? And you know, it takes just a quick glance at the Washington Global Health Alliance's membership to realize that this state is home to so many significant global health organizations. That is attractive to talent because of upward or even lateral mobility. Of course, you know, some people do want to take a job for 40 hours a week and stay in that role for their entirety of their careers, and that's great, and we support that, and you can do that here. But a lot of people want to take a job in an entry-level position. They want to move somewhere or settle into their hometown or in their home region with their families and move up the ladder every couple of years as their technical and their management skills increase. And the global health sector in this region has so many valuable companies that there will be more options for career path opportunities for employees without having to physically move to a new city or state or region. And if our region continues forward momentum to tackle our biggest challenges so it can be an awesome place to work, to live, to play, then local global health companies and their opportunities can actually provide skilled employees sort of intellectually fulfilling and long-lasting careers to support their families. And so that is really how I see Washington Global's health sector contributing to the success of our entire region, especially from an employee attraction and retention standpoint.
Terrific, Rachel. Thank you. Thank you very much for those thoughts. I would like to change now and ask Mayor Burney, when people think about, you know, cities impacted or employing directly global health organizations, of course, most people think of Seattle. But as I shared in the numbers before, there is a decentralization, I use the word decentralization rather than decolonization of that, and really increasing not only the Puget Sound region, but even beyond that. The importance of non-Seattle based organizations is increasing. Just thinking of a city like Redmond, you know, you have organizations in the tech sector like Microsoft that have spearheaded incredible global initiatives like the Global Health Access, the AI for Good, the AI for Health And again, this sort of general trend that local is important that was accelerated by COVID has really sort of driven some of that. I'm curious to know just your thoughts on this and how, from a City of Redmond perspective, these trends, are percolating to you and to both public health in the city and your own thinking about the sector.
Well, thank you so much. First, I just really want to thank you all for inviting me, and I'm really honored to be part of this conversation today. I was absolutely enthralled by the previous panel and everything that you shared. My original degrees in biology and chemistry, and so I was just kind of stirring up some of those early learnings that I had with the work that you all are doing. So I'm honored to be here today. So the City of Redmond is a leader in building connections and leveraging public-private partnerships. And I should also mention that 40% of Redmond's population was born outside of the United States, and our community members maintain many of those global connections. And as Mauricio mentioned, Redmond benefits from its partnerships with Microsoft and other global health organizations located in Redmond, such as Metrics and HealthPoint in the Together Center. And in terms of economic development and jobs, in addition, the researchers employed by Microsoft and other regional organizations on these projects, they work in and live in or near Redmond, and they bring additional dollars to our city that support affordable housing, better schools, and an overall better quality of life. Our city also works closely with One Redmond, our unique Chamber of Commerce, and our Economic Workforce Development Enterprise and Community Foundation. It's all wrapped up into one. And in partnership with One Redmond, we're able to support Redmond and other King County businesses and nonprofits in their economic recovery from COVID-19 pandemic. And I should mention that a lot of those are small 1, 2, 3 person businesses that really struggled, including a lot of health companies that are partners with a lot of the organizations that you all work with. And East King County was the first COVID-19 epicenter in the nation. Redmond and other Eastside businesses were hit first, and they were hit hard. And the effects of the pandemic have been monumental, shifting our focus to recovery and resiliency efforts. One Redmond quickly scaled a program to assist as many small businesses as possible with the support of the City of Redmond. Their One Eastside Spark continues this recovery work while expanding resiliency building efforts in collaboration with King County's 23 cities and towns, chambers of commerce, higher education, nonprofits, and state and county government. They provide responsive programming and tools to address key areas of need amongst small businesses and nonprofits in East King County as they evolve. And I should also mention, from a global health perspective, I feel fortunate for myself and our area communities, as I can honestly say, we have global experts in health and technology right here. One very good example is that we're able to take their many talents. They brought together many organizations and create a world-class vaccine clinic right here in Redmond. Microsoft worked with other large corporations. They brought in our 2 main hospitals of Evergreen and Overlake, and they worked with the City of Redmond, King County, and the state of Washington to vaccinate thousands of people in our community in a very short period of time. And it's one of the reasons our county has one of the highest vaccination rates in the nation. Our success or failure will always come down to how we build and maintain partnerships. No one entity can do it all. So it's imperative that we all bring our unique strengths to the table to further global health initiatives.
Terrific. And I think you set sort of this theme of partnership and the role of the local community in sort of advancing both local health and global health. Mayor Robinson, I'd like to essentially give you the opportunity to answer the same questions, sort of from your point of view, the point of view of Bellevue. Microsoft also has a presence in Bellevue, so do Facebook and Google, and you share with Redmond in many of these sort of tech industry community that are now very subtly spilling into health information and other global health-oriented type of technology. Could you sort of elaborate on the impact that you see in the city and perhaps the trends and its significance?
Yeah, and thank you for having me here today as a health professional. This is really interesting to hear. And Mauricio, you did such a great job of laying out the local global health landscape. And Dr. Godwin did a really nice job of laying out the future of the global health economy. So, Bellevue, Redmond, Kirkland, we call ourselves the Tech Triangle. and definitely a powerhouse of innovation in our region. I mean, our city has 90 global international firms in Bellevue. And if you combine the major employers in healthcare and in innovation, it comprises 60% of our major employers. And that amounts to 14,000 health jobs and 40,000 jobs in technology. We were excited earlier this week to get the news that there's a $77 million investment in our city by a life sciences real estate developer. So that's really exciting. But if you think about all the technology that's in innovation in our cities, that is what's contributing to the IOMT, which is a new term for me, the Internet of Medical Things. And so all the things that allow you to do global health are being created in our city. So like the telehealth hardware and software, data collection, analysis and sharing tools, support systems for interdisciplinary collaboration, medical record keeping, and cybersecurity for those records. And in addition to that, our large employers, many of them have their own global health programs that they're running. So just like Microsoft, Amazon has 2 programs, Meta or Facebook has a program, WhatsApp is helping with family planning with teenagers in the Dominican Republic, Salesforce, Smartsheet, Aptio, and Overlake Hospital Medical Center and T-Mobile. So they are all contributing to our global health systems and to the economy.
Yeah, I think, thank you for that. And it's, you know, what strikes me as you sort of list these type of projects is how much they're accelerating. And I think some of the trends we were picking up at the study where you're seeing, you know, a sort of improvement and increase in the economic activity and the innovation activity. There are, you know, I'm happy to see that the positive trends that you associate with tech are now spilling into healthcare, and they're spilling into global healthcare. And that's ultimately, I think, is very positive. Mayor Sweet, the organizations such as the Exemplars in Global Health, run by Gates Ventures, Pivotal Ventures, led by Melinda French, have long been headquartered in Kirkland. Recently, Global Health Labs established its headquarters in Kirkland as well. Can you speak on the impact of the global health sector in these type of organizations in helping Kirkland grow and evolve? Mayor Sweet, you may
Sorry
be,
about
yeah,
that.
perfect. Okay.
Thank you, Mauricio, and thank you to the WGHA for this opportunity to join the forum with my colleagues this afternoon. I too come from a healthcare background. Kirkland is proud to be home to innovative organizations that you listed that are focused on global health. We'd like to think it's no accident that Kirkland is becoming a hub for science, technology, and other fields that require educated and creative minds. Kirkland's been very intentional in creating a robust and diverse economy. We believe that a business climate that supports entrepreneurial and innovative business practice helps promote job creation, and we worked hard to attract businesses that provide living wages. We are committed to providing superior utilities, transportation, and telecommunication networks to support business growth and help give Kirkland a competitive advantage. We have been supportive of higher education and technical colleges to assure that there is a workforce ready to take on today's challenges, as well as innovate for the future. We invest heavily in our parks, arts, culture, and human services to ensure that those who live and work here enjoy a high quality of life. And we are fortunate to collaborate with regional partners, Bellevue and Redmond in particular. Through these partnerships, we have been able to leverage each of our community strengths to bolster tech growth and innovation in this area. It's through these intentional, calculated actions that Kirkland is seeing lower unemployment, higher job growth than the national average. It's why in 2018, Kirkland was named one of the top 10 best cities in the country for STEM workers. We are thrilled that innovative global health organizations are also attracted to Kirkland. These are exactly the kind of jobs we want in our community. All of our businesses play an important role in generating revenue that the city can use to continue investing in public safety, transportation, parks, and many other amenities and services that provide that quality of life. But more than jobs and tax revenue, having creative, forward-thinking organizations within Kirkland provides opportunities for collaboration and partnership. We hope that global health organizations in Kirkland are not only able to recruit an education and talented workforce, but also thrive within our regional ecosystem of technology and science. The pandemic has illustrated how undeniably interconnected all of our communities are when it comes to health. We could have never guessed that Kirkland, of all places, would be the first epicenter of the COVID-19 pandemic in the US. We saw firsthand how a virus spreading on the other side of the globe could suddenly impact our own community. Thankfully, we're in a region rich with expertise in public health, medicine, and science. We will be forever grateful to those who jumped into action, not just in the early days of the pandemic for our community, but for those who have been working tirelessly to keep people safe and find solutions on a global scale. It is exciting that businesses recognize what Kirkland is doing to foster an attractive environment for job growth and innovation. We also hope that we have laid the groundwork for the businesses that locate here to succeed in solving some of the big problems facing our world and help create a better future for all of us. Thank you.
Thank you, Mayor Sweet, for sharing these thoughts. This conversation could continue in many ways, but I am being reminded the clock is running, so I am going to bring our panel to a conclusion. We really have been honored to have all of you here with us and sharing the great collective value of our broader cities engaged in global health. And now I would like to transition to Adriana Torres-Salazar, representing ScienceWorks, for the next part of our presentation.
Hi, my name is Adriana Tovar Salazar. I am originally from Colombia, born and raised. I moved to the United States when I was about 17 years old with my family, and I pursued a career in science because since I was in 9th grade, I fell in love with it after our teacher went over a protein synthesis lesson that just completely captivated me, and I was very interested in science. First of all, I wanted to be a marine biologist, but life happened, and my father became ill with colon cancer, unfortunately, and he didn't win this battle, which made me even more interested in continuing the work of many people that have done, that have pursued a career in not just science, but in cancer research. And many years later, I ended up at Bristol Myers Squibb, where I currently are a senior associate scientist in doing CAR T-cell therapy research in early development, which is very important for future therapies because it is the foundation of all the building blocks, really, of the future therapies that are going to transform patients' lives. And I am part of a very, very committed and talented and passionate group of people within BMS. And BMS is also part of this larger ecosystem working in Washington State to the advancement of science. And all of this is thanks to a lot of the work that we do include women. I feel that women hold half the sky, and to me that means that women are 50% of the resources of our population, and they're very important in participating in this ecosystem and in research. And more importantly, also women of color like myself, we bring a lot of things to the table where from our different backgrounds and our different cultural experiences, that it's really what science needs in order to work for everybody, because that's ultimately the work, the goal of science is for it to work for everyone who is can benefit. And with that, I would like to introduce the next speaker, Candace, who's the Vice President of Policy and Advocacy at the Partnership to Fight Infectious Diseases.
Thank you so much, and thank you for the opportunity to join you this afternoon. First, I wanted to congratulate all those involved in the Washington Global Health Alliance study, and more importantly, perhaps all those making the significant contributions that are highlighted in the study to improve health globally. Progress is happening despite the pandemic, and with renewed efforts at the local, national, and international level, we look forward to even greater gains. I wanted to highlight one area in particular, given the folks gathered around the table focused around innovation, of an urgent need for innovation that we feel like has not gotten the attention that it really needs, and that is the growing threat of antimicrobial resistance. The fantastic work that Adriana talked about and others of our best and brightest researchers are doing to address serious cancers and other serious illnesses wholly depend on our ability to prevent, treat, and cure common infections, bacterial infections largely, things like staph and strep, E. coli, and others. And in fact, infection is the second leading cause of death for people with cancer. In January, a seminal study on the global burden of antimicrobial resistance noted, previous slide, please. In 2019 alone, that's pre-pandemic, more than 1 million deaths globally were directly caused by AMR, or antimicrobial resistance. In addition, more than 5 million deaths had AMR as a contributing factor, and 1 in 5 of those deaths were among children ages 5 and younger. That's a higher toll than malaria and HIV globally, not to diminish either of those diseases, but just to highlight the need to raise the profile and urgency to address AMR. Next slide, please. Like COVID, we saw how it does impact us all. AMR is also a global problem in need of innovation. As this chart shows, and I apologize, the type is really, really small, but on the left side is countries in Western and Sub-Saharan Africa. In the green column, the darker green are the direct deaths from AMR, and the lighter green is total deaths related to AMR. And then you go all the way to the far right, and that's Australia. The point of the slide is that although the toll is higher in some regions, it affects all of us and affects us significantly. And it's a global problem. Last slide, please. As we continue to respond and recover from COVID and see the benefits of innovation has brought to our ability to manage COVID, and treat it and prevent infections, attention is turning in policy circles to preparing for the next pandemic and what that may look like. It's important to note how interrelated the AMR and pandemic issues really are. And we feel like pandemic preparedness should include AMR as a part of that, both nationally and internationally. There was a study just out earlier this week that shows amongst US patients admitted to the hospital for COVID and for reasons not related to COVID, that AMR was much higher in those admitted patients than even pre-pandemic levels. So we're seeing the problem get worse during COVID. Solutions involve prevention, and that includes innovations around vaccinations and other ability to avoid infectious diseases that can lead to infections that require antibiotics, greater stewardship in the judicious and appropriate use of antibiotics, both in humans and in animals, and innovation in the development of new antibiotics, antifungals, and diagnostics that let us know which antibiotic will work against the infection we're dealing with. And we need better incentives to spur that innovation. The UK is out front with a novel solution that will attract greater investment in antibiotics. And the US has legislation now pending that adopts a similar subscription or Netflix-like model to attract that investment needed. And that's called the Pasteur Act, if you're not familiar with it. I did want to mention that Washington's own Senator Patty Murray is leading efforts on the Prevent Pandemics Act. And that bill is the primary pandemic preparedness legislation that's currently under consideration in Congress. Unfortunately, there's some work around AMR, but not a lot in the bill currently around AMR. We welcome to share more information about this important issue and invite you to visit our website and follow us on social media, and that information is on the slide. And again, so appreciate the opportunity to speak with you today. And on behalf of the Partnership to Fight Infectious Disease, thank you again for all you are doing in the state around to improve health for all of us globally. Thank you.
Thank you, everyone, so much for joining us this evening. It's been an absolutely fabulous conversation, and really a lot of insight has been gained not only from the impact perspective that has these wild and amazing social ramifications, but also to really focus in on those economic possibilities are truly amazing. We really do want to thank every single one of our panelists tonight. We recognize that each of you has an exceptionally busy schedule, and that each of you very high profile panelists have quite a bit to do. So thank you again so much for participating in this panel. We hope that everyone did have a chance to learn something new about the impact that global health organizations have here in Washington State, as well as beyond. And a special thanks goes out to our member organizations. For those of you who are interested about membership with WGHA, please do let us know. We strive to further the innovation and connections that we have within our membership and make sure that people are actually connected to one another and moving forward on not only working on the problems at hand, but making sure that we've got those partnerships as well. If you haven't already, don't forget to subscribe to Field Notes. This is something that we do on a bi-weekly basis from WGHA that highlights the activities of our membership within WGHA. And again, we really, truly appreciate your attendance today, and we very much hope to see you at our next event. And with that, thank you all and have a wonderful evening.